Joining us right now is Dr. John Chessare, the President and CEO of GBMC Healthcare System. Once again, Dr. Chessare, it is really great to have this partnership that we have here at WBAL News Radio 1090 and FM 101.5 with GBMC. Thank you.
Yeah, and we are delighted to be in the partnership with you. Thank you so much for your hard work in educating the community.
Let me ask you, Dr. Chessare, we're going to be joined by Dr. William Zirkin in the next half hour, who was your first physician to get a vaccine. He's in your emergency room. How's that going? How is your staff and everybody when it comes to actually getting the Pfizer or Moderna vaccine?
Well, our team has done a remarkable job in giving the vaccines. I know there's been a lot in the news about the speed at which vaccines were being given. And I think the full story was not being told because we had to create systems that did not exist to be able to immunize people. Right now, we've given over 6,000 doses of the Moderna and Pfizer vaccine. This week, people are getting their second shot. Dr. Zirkin and I and a couple thousand other GBMC colleagues are getting the second shot to be protected. And as you know, we are in the governor's phase 1B. We have started to immunize citizens that are 65 years of age and older. Last week, we started immunizing people 75 and above, and now we've added 65 and above. And GBMC has also jumped in to help immunize educators and school staff people to get children safely back into the classroom.
So can you explain how that works? Are you going to receive additional vaccinations throughout the time frame that we're doing this? Since obviously you're going to take care of your employees first, but how many vaccines do you expect to get, and then how do you determine how you dole them out?
So the question of how many doses will we get every week is kind of fluid. The state finds out from the federal government how many doses will be available for the whole state. And then the people in the health department are working extremely hard to send those doses to hospitals and now community agencies, health departments in particular, to maximize the speed at which the doses can be given. The part that's frustrating for us, and we understand why, is that we don't actually know how many doses we're going to get week to week. We'll find out on a Sunday night or a Monday how many doses we're getting that week, which makes it very difficult to schedule people for the vaccine because what we don't want to do is schedule somebody and then have to contact them to tell them we don't have a dose.
Right.
But our team has done a marvelous job of minimizing this frustration to patients, and we've pretty much only been opening up slots when we're sure we have the vaccine.
We're talking with Dr. John Chessare, President and CEO of GBMC Healthcare. You're listening to The Coronavirus, our virtual town hall special where we partner with them. And Dr. Chessare, it's a two-shot regimen, whether it's the Pfizer or the Moderna. Are you holding back shots to make sure that when the person gets the first shot that they're guaranteed a second one, or how's that process working out?
Well, yes, I think the mental model might not be seen as holding back. I think it's assuring that we have the doses. So literally every morning, our team is checking back to make sure to see how many people are scheduled and how many doses we have. And if it's somebody scheduled for a first dose, we're thinking into the future, 3 weeks generally, to assure that we will have a second dose for that person.
Can you give us an idea of what the participation percentage was for hospital workers? I mean, were you disappointed, or what was it? Were you happy? Was it satisfied? Obviously, it was not. You didn't compel anybody to take it, but what was the percentage of people who did take it?
We don't have a good handle on the precise percentage, and that is because there's a lot of healthcare providers out there that work in multiple facilities. You know, members of our medical staff may have privileges at 3 different hospitals. So it's hard for us to tell, did the person decide not to have the vaccine or did they get it somewhere else? There's other members of our clinical staff, some nurses that work in multiple places. To the extent that me personally, as a scientist, somebody with a degree in public health, I'm disappointed if anybody refuses the vaccine because for me, the evidence is absolutely clear that your risk of dying of the disease is way larger than your risk of getting hurt from a vaccine. We've seen at GBMC, we've seen no significant side effects of any vaccine. We had one patient, one individual who did not disclose that he had had a reaction to a previous immunization, and he got a rash. He was watched, and the rash went away, and he did fine. And we encouraged him to be complete in telling people about previous reactions. But other than that, we have had no significant reaction to the disease. And as you know, we've had a fair number of people die of this disease across our region.
President and CEO of GBMC Healthcare, Dr. John Chessare. You know, the Governor Hogan talked about using a Southwest Airlines model when it comes to if there's shots sitting around and people don't want to take them, getting to the next person. How are you handling last-minute cancellations, no-shows when it comes to the vaccine?
Our team has done a marvelous job. We have a list of people that are willing, and we contact them immediately if we think that there is a slot that has not been used. Yesterday, we gave the largest number of vaccines since we started back in early January. So our team has gotten pretty good. They watch the schedule, they watch the arrival rate, and if they see that it's possible that a slot would go unfilled, they immediately contact people that come in so that we don't waste the slot. We have wasted 0 vaccines.
Excellent.
Yeah.
Excellent.
Dr. Chessare, great to have you on
so
as
much.
always. Thanks very much for your time and the partnership with GBMC. We greatly appreciate it.
Thanks so much, guys. We really appreciate working with you, and thanks for getting the truth out there.